attending. Happy New Year to everyone. And as you guys know, my name is Doug Sully. I run Sully Safety Services based in Mississauga. I have been a member for about a year and a half now with the association. And today I wanted to take a few minutes before we get started with the mandate, as we are on the annual renewal here, to talk about some of the changes that recently came up with COVID and some of the restrictions, as well as some of the changes in requirements for self-isolation and monitoring. So I'll kind of just dive right into it. Unfortunately, they have decided to start locking things down again. I was really hopeful that this would not happen again. Unfortunately, for some businesses, this does pose significant issues. And with regards to offices, the big thing right now for offices is if you have workers that are able to work from home, then you should have them working from home right now. With regards to setting up specific times for people to come in and things like that, I mean, for the time being, I would try to avoid that as much as possible. I do know that the HBA, the Ontario HBA, recently released a guideline for sales centers and design studios and things like that. So those measures would definitely be what you need to follow at this point in time. And I know the West End actually released that as well. So I guess the big thing right now, some of the recommendations I have are making sure that your guys out on site, especially if they're in the units, are wearing masks. I know myself, I've been out to sites for some of the builders, and I know that I have seen that they aren't wearing masks inside the units. Okay. Outside, when you're outdoors, it's very difficult to actually enforce this, to tell someone who's outdoors by himself that they need to wear a mask. I would recommend that at least you have that conversation, but if you see a group of people together, then they have to have masks on. So indoors in any workplace, it is required to have a mask on at all times. These are the current requirements, and now that we have gone backwards, they are going to be enforcing this strictly. Outdoors, if physical distancing can be maintained, the likelihood of you forcing someone to wear a mask is very minimal. If physical distancing is not possible, then I would make sure that they are wearing masks, and make sure that this is reminded to all your trades and all the trades and all the workers that are going to be working on your sites. So the other big one right now is the changes to the self-isolation. So at this point, rapid testing is, well, intermittently available. Unfortunately, it's not as available as it probably should be based on the guidance that's been provided. However, now, if any worker exhibits any symptom that is listed under the potential symptoms for COVID-19, they cannot come into work. They do need to stay home, and they need to isolate. If the person is vaccinated and has received 2 doses of an approved Health Canada vaccine, they are permitted to isolate for 5 days at minimum. And on the 5th day, if their symptoms have improved within 24 hours, they are permitted to come back to work. Okay. If a worker is unvaccinated, that person must stay home for a minimum of 10 days. And there is no specific exemption or anything in that state. If a worker comes into contact with someone or is deemed to be a close contact, the worker is, if they are vaccinated and they do not have any symptoms, they do not have to self-isolate. They only need to self-monitor at this point in time. However, if they show symptoms, then they will have to self-isolate at that point. The only exception to this is if a worker is exposed through someone in their own household. If someone in their household has symptoms, then everybody within that household must self-isolate. And there is no exception to that. The minimum would be 5 days if you are vaccinated, and if you're unvaccinated, it is 10 days. There are no PCR tests are no longer going to be available to the general public based on whether someone has symptoms to confirm if they have COVID. It is assumed at this point in time that if someone has symptoms, they are to stay home and assume that they do in fact have COVID at this point. One concern I am going to have, and I'm sure many of us are going to have as we move, probably not right this moment, but as we move into March and April, we do get into allergy season. And that is going to pose significant questions and concerns. I do hope that there will be some additional guidance on that. I think the rule of thumb really is if someone has allergies and they have the same symptoms every year, then it can probably be deemed that it is in fact allergies that is the concern. If there's a new symptom or if there's a worsening symptom, in any case, regardless of whether it's allergies or not, then the worker needs to stay home and they need to assume that it is COVID. Rapid tests will be a great way to help monitor. The best thing to do at this point is to monitor through any chambers of commerce or associations to see as they become available. If you do have access to them, then I would make sure that I would source them and I would use those. My rule of thumb and my understanding is that at this point, if a worker has symptoms, then it is probably the best idea to use a rapid test at that point. I do know that workplaces are using them more frequently, but I know they are best served when the worker has potential symptoms to be used at that point. Other than that, the same rules apply in regards to screening. You need to be screening workers prior to entering your sites. You need to be screening workers prior to entry into any workplace. And you need to be monitoring. So with regards to your trades, making sure that they are completing documentation as well as being screened at the front entrance is going to be your best course of action at this point in regards to screening. Physical distancing, I know in some cases where it is possible, physical distancing should be implemented. This includes reduced number of people, reducing trades in the buildings, things like that. I know this is not always feasible and it's not always possible due to, it could be safety issues that could arise due to the work being performed. But whenever possible, we need to try and implement physical distancing. Make sure your toilets, make sure your cleaning stations are all set up. Make sure the toilets have proper heat going into them as well during the winter months here. So these are some of the things that the Ministry of Labor will be looking for on site. And I also would have to say that you need to make sure that you have your COVID safety plan. So make sure that it has been updated. Okay, make sure you have the most recent requirements and how they will apply to your specific situation. So currently, they are recommending N95 masks. And I think the best way to look at it is from an enforcement standpoint, they would look at it as what you're doing is reasonable. And basically what they're saying is the public health guidelines are kind of what are the reasonable requirements at this point. So right now they are recommending the N95s. So I would strongly recommend that you kind of switch from the current medical mask, not non-surgical masks, to the N95s. And that would probably be a best practice at this point in time for the workers on